Joining me now is Republican Governor John Kasich of Ohio. He's the author of the new book, Two Paths, America Divided or United, which will be on the bestseller list, his fourth on that list. Governor Kasich, thanks so much for joining me.
Thank you. Thanks, Jake.
So, Governor, you've called the House Republican health care bill, quote, woefully inadequate and very disappointing. What, in your view, is wrong with the bill?
Well, first of all, Jake, in the area of Medicaid, they're going to eliminate Medicaid expansion. And I cover in Ohio 700,000 people now, a third of whom have mental illness, drug addiction, and a quarter of whom have chronic disease. In 2020, that program is frozen and people cycle off that program. Now, I don't have a problem with trying to move the Medicaid expansion, which gives an enhanced match from the federal government to a more traditional match, but you can't do that overnight. So what happens to those people? Well, they're going to go over on the exchange. Now, here's the problem with the exchange. They give you about $3,000 or $4,000, a tax credit of $3,000 or $4,000 to buy health insurance. Now, what do you think you can buy for $3,000 or $4,000? Do you know what the deductible would be in that? And in addition to that, for people who have these challenges, whether it's drug addiction, mental illness, or chronic disease, they've got to see the doctor on a regular basis. So how do we think that the mentally ill have the ability to pay the deductible on an insurance policy that they can buy for $3,000? Let's say they're 40 years old. They buy an insurance policy between $3,000 and $4,000. It's inadequate.
Well, let me ask you,
so
sir.
You have
you just heard
you're going to have people who are going to
go ahead.
Go ahead.
No, you go ahead. Sir.
I was going to say you're going to have a lot of people. Where are they going to go? That's a real problem, and that doesn't mean the system doesn't need to be reformed. It can be. But, you know, this was not great, and it's going to go to the Senate, and I hope and pray they're going to write a much bigger bill. Look, I'm out as governor in 18 months, okay? I'm sure there's some people out there that will applaud that. So this doesn't really affect my operation directly, except for maybe these cuts, which I'm not sure what they are. But I'm worried about the future, and I'm worried about these people who are really vulnerable.
Well, let me ask you some questions that I asked Dr. Price. You just heard him a few minutes ago. One, Donald Trump promised that there would be no cuts to Medicaid. This plan obviously would reduce Medicaid payments to states by $880 billion over 10 years, according to the Congressional Budget Office. Is that a cut?
But that doesn't even count. But, Jake, that doesn't even count Medicaid expansion.
Right.
You see, come 2020, that's eliminated. And people who are on it can stay on it, but most people cycle off because they get work, their income goes up, and once they're off, they're off. They can't go back on. And I'm not opposed, again, to changing that, but you can't do it just overnight. It has to be done over a period of time.
Well, first of all, is it a cut, and is this a broken promise of President Trump?
Well, when am I going to start? I'm not here to really get into what you do the analysis of what the president said and what we've done. But look, the problem is, and you pointed it out, the reason why a lot of doctors do not take Medicaid is because the reimbursement is low. And so the whole problem with what we're debating today is not just insurance coverage, because that's what we're talking about. What we're not talking about are the things that need to be done to lower the cost of medicine. And let me also tell you, I told President Trump in the Oval Office that governors need to have more authority to have more leverage over these pharmaceutical companies, because the Democrats gave me a law that says I have to cover everything, every drug, whether I can afford it or not. And the fact is, I have no leverage. So I said, let me exclude these high-priced drugs, give me leverage, and I'll be in a position to drive that cost down. That is not in this bill.